Radhe Radhe students, welcome back my YouTube channel FlorenceNova. Today we will discuss the care of surgical patient. Surgical surgical patient and alternative therapies. Surgical care is not just about the operations; it covers the entire journey of the patient, and this is called perioperative nursing, and it has three main phases. All healthcare team members, including doctor, nurses, anesthetists, work together during this periods to ensure patient safety and better outcomes. Let's understand the three phases. First is perioperative. Perioperative start the moment the patient says yes to surgery and end at OT door. Here we prepare the patient. Intraoperative is the actual surgery time in the operations theatre, and postoperative begin when the patient come to recovery, and this is further divided in two form. First is phase 1 is immediate post-op care in PACU, and phase second is when we prepare the patient for discharge or home care. Each phase has specific nursing responsibilities. Okay, phase 1 and phase 2. Okay. Uh, one questions is there. The period 24 hours before surgery is called intraoperative period, postoperative period, and preoperative period, and recovery period. Comment your answer. Okay. राइट आंसर इज प्री ऑपरेटिव पीरियड. प्री ऑपरेटिव पीरियड सर्जरी से पहले का जो टाइम होता है, जहाँ पे पेशेंट यस बोलता है, एंड उससे लेके ओटी तक का जो टाइम ड्यूरेशंस होता है, वो आपका क्या होता है, प्री ऑपरेटिव पीरियड्स होता है. Okay, next, pre-operative nursing cover the entire surgical experience of a patient. It is divided into three phases, and pre-operative start from the decisions and end when the patient enter OT. Intraoperative is the time in the OT itself, or post-operative begin in the recovery room and continue until the patient is fully healed or discharged. All healthcare teams members are involved in all three phases to ensure continuity of care. Okay, next, the pre-op phase is also about preparations, our main goals, and to reduce the patient anxiety. Do a complete health assessment, teach them what to expect, and prevent complications. Okay, informed consent is very important. Informed consent is very important. It is the surgeon duty to explain, but the nurses must act as a witness, and we make sure the patient and family understand everything and have no doubt. And the signed consent form goes with the patient to OT. Next, आपका during pre-op assessment, we collect complete informations. This include medical history, allergy, current medications, and lifestyle habit like smoking or alcohol, because they affect healing and anesthesia. And a physical examinations and lab tests are done to make sure uh, to make sure um, the patient is fit for surgery. And nutritions and hydrations are also physical nutritions, nutrition and eliminations. Okay, nutritions and hydrations are also critical, and a well nourished, well hydrated patient heal faster. We also monitor IV fluids and out to prevent imbalance. Okay, next है आपका before surgery. We prepare the patient body, and the most important order is NPO, and nothing by mouth after midnight, and this prevent the patient from vomiting and aspirations during anesthesia. For bowel surgeries, we give an anemia to empty the bowels, and for pelvic surgeries, A catheter is inserted to keep the bladder empty and prevent injury during surgery, and these steps make surgery safer. Okay, next, hygiene is a key to prevent infections. We ask the patient to take a bath before surgery and to reduce bacteria on the skin. On the day of surgery, the patient wear only hospital clothes. We remove nail polish because we monitor oxygen saturations through nails. Hairpin are removed because an unconscious patient can get injured by them. A surgical cap keep hair away from the surgical field. Okay, next है आपका pre-op medications are given to prepare the patient for anesthesia and surgery. Narcotics like morphine provide sedations and pain relief, and anticholinergics like atropine dry up secretions so the patient does not choke, and antiemetic prevent vomiting after anesthesia. H2 blockers reduce stomach acid to prevent aspirations pneumonia, and these are usually given 30 to 60 minutes before surgery, either IM or IV. Before transferring the patient to OT, uh, we use a checklist to ensure nothing is missed, and this is called a timeout. And we verify consent and pure status vitals and that all pre-operative preparations are done. We also provide emotional support and reassure both patient and family, and this checklist reduce error and ensure patient safety. Okay, legal document signed before surgery is consent form है, NPO form, discharge form and referral form. Question the right answer is consent form. Okay, next, a good rest before surgery help in healing and reduce anxiety. Sometimes we give mild sedative, and all valuable must be removed to prevent loss and injuries. And jewelry can cause burn during electrocautery and can cut circulations if swelling occur, and prostheses like dentures must be removed because they can become dissolute and cause aspirations, but hearing aids can stay if needed for communications. Just inform the OT team. Okay. Skin preparations is done in OT just before incisions to make the area sterile, and temperature control is very important. Patient easily become cold due to anesthesia and cold OT, and hypothermia is a dangerous because it increase bleeding and infections and delay in healings. So we monitor temperature and use warming blanket, maintain normal body temperatures, improve patient outcomes. Anti-embolytic stockings are used to prevent blood clot in the legs after surgery. When patients are immobilized, blood can pool in legs leading to DVT, means deep vein thrombosis. And these stockings compress the vein and help blood return to the heart. We must measure and apply correct size. Patient safety is most important, and we follow protocols to make sure we have the right patient, right surgery, and right time. This is called the surgical safety checklist. Okay, next is um, preoperative cares cover all aspects of the patient. Physically, we prepare the body with NPO, hygiene, and medications. Psychologically, we reduce fears and anxiety, and for safety we remove hazards and follow protocols, and our goals is to send a patient to OT who is physically fit, mentally prepared and safe. Good pre-op care directly reduce post-op complications. Okay, next, NPO before surgery means nothing by mouth, no pain operations, new patient operations, nurse patient observations. Think and then give answers. Right answer is nothing by mouth. Okay, next, patient safety is our top priority in OT, and the universal protocols was introduced in 2004 to prevent wrong site surgeries. First, we verify everything: patient name, surgery, and site. Next is the surgeon mark the correct site, and third is we do a timeout where the whole team stop and double check before starting. If there is any confusions at any step, so we must stop and clarify. And these protocols have saved many lives. Okay. Okay, next step, teaching the patient before surgery is very important. When patient know what to expect and anxiety decrease. We teach them about uh, pain management, so they are not scared. And we also teach exercise like deep breathing exercise, coughing, which prevent lungs complications after surgery, giving honest informations and emotional support help the patient cooperate better and recover faster. Okay, next is uh, before surgery we give specific instructions. Tests are done, skin is prepared, and patient must be NPO, and all jewelries and dentures are removed for safety. We also teach breathing exercise. Diaphragmatic breathing help expand lungs and prevent atelectasis after surgery. For abdominal patient we teach them splint the incisions with a pillow while coughing or breathing to reduce pain. Practice this before surgery. Okay, next, after abdominal or chest surgery, patients are at high risk for lungs problems, and because they are afraid to breathe deeply due to pain. If we do not do breathing exercise, mucus collections in lungs and cause infections, and that's why we teach these exercise before surgery itself, so the patient can do them immediately after. As nurse, we must demonstrate, supervise, and motivate the patient to do these exercise every 1 to 2 hours. Okay, after surgery, especially abdomen and chest surgeries, patients are at high risk of lungs complications because of pain, immobilities, and anesthesia. Breathing exercise help to expand the lungs, clear secretions, and prevent pneumonia and atelectasis. We teach these exercise before surgery and start them as soon the patient is awake after surgery. Okay. Splint cuffing is very important after abdominal surgery, and the pillow act as support, so cuffing does not hurt the incisions but still help clear secretions. Purse lip breathing help keep airway open longer and improve gas exchange. The 448 method, slow breathing and prevent air trapping. It's especially helpful for the patient with COPD. Means 4 second hold, 4 second exhale, sorry, 4 second inhale, then 4 second hold, and then 8 second is inhale. 448 फॉर्मूला होता है ये हमारा. Okay, next है आपका these are incentives breathing exercise, and they make deep breathing interesting, and especially for children. Smell the flowers and blow the candle. Help patient take deep breath and full exhalations. Balloon blowing provide registrations and help expand lungs, but we must be careful it not for patient right after major surgery or with heart or lungs disease unless the doctor allow it. Next is huffing is a gentle way to clear secretions instead of forceful cough that can hurt the incisions, and the patient make a huff sound to the move mucus up. And to summarize, all these exercises have one goal: keep the lungs clear and prevent complications after surgery. As nurse, we must teach, demonstrate, and supervise these exercises every 1 to 2 hours post-op. Okay, next is lateral coastal breathing, focused on expanding the lower part of the lungs. And this is important after surgery because the upper chest is often used for swallow breathing due to pain. And the nurse provide resistance with hands during inhalations to strengthen respirations muscles. And once the patient learn, they can do it themselves by placing their own hands on ribs, and this prevent atelectasis and improve oxygenations. Next is incentive spirometry is a device used to increase deep breathing after surgery, and the patient inhales slowly and try to raise the balls to the uh, goals goals label, and this ensure the lungs are fully expanding. And we do 10 breathe 5 times a day, and it very effective in preventing pneumonia and atelectasis. As nurse, we must coach and motivate the patient to use it correctly. Okay, next foot and leg exercise are simple but very important. Ankle pump and leg movements prevent blood clot and stiffness when the patient is immobilized. And when transferring to OT, patient safety is key, and we use to identify identifiers, name and hospital ID. All reporters go with the patient. If the patient can walk, they go ambulatory. If not, so we use a stretchers. Family are sent to the waiting area and uh, inform about surgery. The immediate post-op periods is the most critical, and the patient is brought to a PACU where monitoring is continuous, and we assess ABC, airway, breathing, circulation first, and then we check LOC, level of consciousness, pain, and the surgical site for bleeding. The goal of these this phases is to recover from anesthesia safely and stabilize vitals before shifting to the ward. Any change must be reported immediately. Okay, when the patient come to recovery, our first job is assessment. We check consciousness to ensure brain functions is returning, and glaucoma scale help us document is objectively. Vitals are monitored very closely because this is the time when complications like bleeding and shock can occur. Hypovolemia is the most common reasons for low BP after surgery, and due to blood loss or fluid shift, early detections is a key. Okay, next is skin color. Skin color tell us a lot about circulations and oxygenations. Pale or blue lips means the patient may not be getting enough oxygens or blood flow. We cannot transfer the patient to the ward until they meet all these criteria, and the patient must be stable, breathing well, and not at a risk of aspirations. This ensure patient safety during transfer. Okay, so next is before the patient arrive from OT, we prepare the rooms, and everything should be ready: bed, oxygen, suctions, and monitoring equipments. When the patient arrive, so we do a quick but complete assessment. Sometimes we have to act immediately as per doctor's orders, like starting fluids, and a good handovers from the OT nurse give us all important informations about surgery, blood loss, and drain. Next is after initial assessment, we review the post-op orders carefully, and this tell us keyword diet, fluid, medications, and activity the patient can have. We also read the operations record to know exactly what was done in surgery, and this is important to monitor drain and watch for complications specific to the surgery. And proper documentations and following orders ensure safe recovery. Pre-op care start with ABC. First, we ensure the airway is clear, suction is kept ready for patient who cannot clear secretions. Pain management is critical. If pain is not controlled, the patient won't breathe deeply or move, or we use both medicines and non-drugs methods. Early ambulations is one of the best way to prevent complications. Even juggling legs in bed help circulations and prevent blood clots, and we progress gradually based on patient strength. First priority in immediate post-op periods is option A, pain management. Second, airway breathing circulations. Next is wound dressing, and next is diet. Comment fast. Okay, right option is B, airway breathing and circulation. Okay, next है airway and suctioning maintenance आपने रखना है, leg exercise, pain management, early ambulations, range of motions. Okay, leg exercise are very important for bedridden patient. Simple ankle pump help blood return to the heart and prevent clot. Breathing exercise must continue. Post-op incentive spirometry help the patient take deep breathing. Positioning every 2 hours hourly is mandatory. It prevent bed sores and improve lung functions. For abdominal patient, semi-fowler positions is best because it reduce pressure on the incisions and help breathing. Next is after surgery, patient often have trouble urinations or passing stool due to anesthesia and painkillers. We monitor intake output closely. Ambulations and fluid help restart bowel functions. Hydration is vital for healing. We check for a dehydration sign and ensure fluid are given. Once oral fluid are allowed, so we start sip and gradually increase. Wound care is done daily using style technique, and we look for any sign of infections and monitor drain. Documentation is very important. Nutrition is the building blocks for healing. We start with clear liquids and advance as tolerated. Protein help in wound healing. We also watch for nausea. All these 10 interventions together ensure the patient recovery safely without complications. Most important nursing interventions to prevent post-op atelectasis is option A, IV fluid, B, deep breathing and coughing exercise, C is bed rest, and D is antibiotic. Comment fast. Right answer is B. ओके कुछ क्वेश्चंस दिए हैं, इंपॉर्टेंट क्वेश्चंस हैं जो रिपीटेड फॉर्म पे आपके यूनिवर्सिटी एग्जाम्स के अंदर आते हैं, तो एक बार जरूर इनको रीड करना और आंसर्स अपने सॉल्व करना है. ओके, नेक्स्ट है आपका अल्टरनेटिव थेरेपीज. Alternative therapies are becoming an important part of modern nursing care. They are not meant to replace medical treatment but to work alongside it. The main focus is holistic care, treating the whole person, not just the disease. In medical surgical patient, these therapies help with pain, healing, immunity, and mental health, and this reduce hospital stay and improve patient satisfactions. Okay. Okay, first is acupuncture. Acupuncture is widely accepted now, even in Western hospitals, and the thin needle are placed at specific point to balance the body energy. For surgeries, it is very useful for pain control without extra medications. It also reduces nausea after anesthesia and chemo. In neuro patient, it help in regarding regaining nerve functions. As nurse, we should know about it for patient educations and referral. Okay, acupuncture is based on the concept of, right answer is meridians. Okay, next है acupressure. Acupressure is the needle-free versions of the acupunctures. It is very safe, and patient can even learn to do it themselves. It exactly for pain, excellent for pain, nausea, and anxiety in hospitals patient. For example, pressing the uh, P6 points and help with post-op nausea. And since it non-invasive, we can teach it to patient easily, and it has no side effects. Next is herbal. Herbal medicines has been used for thousands of years in medicine nursing. Herbs are used to support healing. Some herbs reduce pain and inflammations. Other help wound healing faster. As nurse, we must remember always check for herb drugs interactions before giving herbal supplements. Document what the patient is taking. Okay, next use of herbs and plant produce for the treatment is called. Right answer is herbal medicines. Next is yoga and meditations are holistic practice. They do not just work on the body but also on the mind. For med surg patient, yoga help in recovery after surgeries, improve lung capacities and control blood pressure. Medications reduce stress hormones which otherwise delay healing. As nurses, we can teach simple breathing exercise and relaxing technique to patient. Next is Chiropractors focused on the spine because it connected to the nervous system by the adjusting spinal joint, and they relieve pain and improve mobilities. Massage Massage is one of the most commonly used complementary therapy in hospitals. It improves circulations, which is important for the wound healing and preventing DVT. It also reduces the pain and anxiety, so patient need less analgesics. Even a 10 minutes back massage can help a post-op patient relax and sleep better. Next is aromatherapies. Aromatherapy use natural plant oils like lavenders for relaxations, peppermint for nausea, etc. In hospitals, it used in massage therapy or diffusers. It helps patient feel calm before surgeries and improve sleep. As nurse, we must check for allergy before using essential oils and never apply undiluted oils directly on the skin. Yoga, meditations, and pranayam comes under. Right answer is B. Complementary and alternative medicines. Okay, next है आपका homeopathy is based on the idea that like cure like. Is a substance that cause symptoms in a healthy person can treat similarly symptoms in a sick person, but in very diffuse dilute form. It is a controversial in conventional medicines, but may a patient use it. As a nurse, our role is to document if the patient is using homeopathic remedies and check for any interactions with the prescribed medications. Okay. Next, music therapy. Music therapy is not just playing music, it is a structural therapy done by the trained professionals. In hospitals, it used to reduce anxiety before surgeries and manage pain and help patients with neurological problems. Next is naturopathy. Dietary therapy and naturopathy. Naturopathy believes that the body can heal itself if give the right environment. Diet is the main tools here. For med surg patient, dietary therapy help in managing diabetes, hypertension, and obesity, and it also improve digestions after surgeries and boost immunity. This approach is drugs free and focused on lifestyle. As nurses, we educate patient on healthy diet, hydrations, and natural methods to support recovery along with medical treatment. To conclude, alternative therapies are complementary tools in modern nursing, and they do not replace surgery and medicines but help in a faster recovery, pain management, and holistic healings. Our responsibility as a nurse is to assess what therapies the patient is using, educate them about safety, document it, and coordinate with the healthcare teams. Integrated, these therapies improve patient satisfactions and overall outcomes. Okay, top 5 most important exam points. एवीजी इन पोस्ट ऑप मीन्स एयरवे सबसे पहले आता है, तब कि अगर हम सीपीआर की बात करें तो वहां पे जो आपका पैटर्न है वो क्या है, सीएबीजी के उससे आप यूज करते हो. लॉन्ग क्वेश्चंस एंड शॉर्ट क्वेश्चंस दिए हुए हैं. ओके, थैंक यू.